There are many different treatments for heart disease, and they all have risks and benefits associated with them. The benefits and the risks are the same as the advantages and disadvantages, pros and cons, or for and against arguments. For your exam, it's important that you can evaluate the methods of treatment that you've studied. So when asked to evaluate something, you have to weigh up both the advantages and disadvantages. You have to weigh them up, and you could be asked to decide which treatment is the most appropriate given the advantages and disadvantages. For example, how can we evaluate the use of replacement heart valves? Using the table and your own knowledge, evaluate the use of mechanical and biological replacement heart valves. Remember that valves can be faulty or leaky and may need replacing. Questions like this one could be in the exam, where you're given information like this table here and have to apply it alongside what you already know. So where do we start? Step 1. Carefully read the table headings. So the two headings in this table are mechanical valve and biological valve, so we know that the table compares mechanical and biological valves. So what are we comparing about these valves? If we look over in the left-hand column here, we can see different titles. So we're going to compare the risk of death from heart-related problems after valve replacement, the chance of failure after 5 years, and the percentage of patients who had a blood clot in the brain after surgery. Step 2. Compare the information given in each row. So we're going to start with this top row, the risk of death from heart-related problems after valve replacement. A quick comparison of the two shows straight away that there's a greater risk of death from heart-related problems with a biological valve than a mechanical valve. When it comes to the chance of failure after 5 years, there's no need for replacement with a mechanical valve. However, with a biological valve, sometimes another replacement is needed after 5 years. Therefore, with this example, it would seem that a mechanical valve is better than a biological one. Finally, in this bottom row, we can see that the percentage of patients who had a blood clot in the brain after surgery was greater for the mechanical valve compared to the biological valve. Step 3. State the advantages and disadvantages. This is where you get to weigh up the information that's been provided in the table. So there's a slightly lower risk of death from heart-related problems with a mechanical valve, which we found out from the first row. You could also say that the survival rate for a mechanical valve is higher compared to a biological valve. Mechanical valves last longer. So this piece of information comes from the second row, that there's no need for replacement of a mechanical valve after 5 years. Patients are also more likely to need further operation with a biological valve, shown in this part of the table. Remember that all surgeries come with risks like bleeding or infection and often require long recovery periods. Finally, biological valves are less likely to cause a dangerous blood clot. This information came from the bottom row, where you can see that only 0.1% of patients had a blood clot in the brain after surgery with a biological valve. Because the question asks you to also use your own knowledge, you could also say several other things. So step 4, consider what else you know that you could add to your answer. Questions don't always ask you to use your own knowledge as well, but here it does. So what do we know about mechanical valves? Due to clotting risk, a patient has to take anti-clotting medication for the rest of their lives. This medication could lead to excessive bleeding. However, mechanical valves are readily available. Now, what do we know about biological valves? First, you have to find a suitable donor, and the valve is more likely to be rejected by the body. Patients may need to take immunosuppressant drugs to prevent their own immune system from rejecting the donor valve. Also, if you're using animal tissue, there are ethical issues to consider. You could add these extra details into your answer to get more marks.
Thanks for watching. If you want to take your GCSE revision to the next level, head over to launchpadlearning.com and check out our smart learning platform that's been designed to get you top results in your exams. We cover your whole specification and make revision fun with interactive quizzes, easy to follow videos and more. You'll be kept motivated by your own AI tutor who's here to support you every step of the way. To check it out for yourself, click here. Or click here to keep watching a selection of the videos from our full GCSE Biology course. See you there!